Hi, I'm Dr. Aliya Szpindel, lead author on the paper Epilepsy in Children with Cerebral Palsy, a Data Linkage Study. Today, I'll be presenting a podcast on our paper recently published in Developmental Medicine and Child Neurology. The prevalence of epilepsy in children with CP is highly variable, with estimated reports between 15 to 60% worldwide. Epilepsy has been identified as one of the comorbidities of cerebral palsy associated with increased healthcare utilization. However, despite this, little is known about healthcare utilization patterns in children with coexisting epilepsy and cerebral palsy compared to children with a single diagnosis of CP or epilepsy alone. The purpose of our study was therefore to determine the prevalence of epilepsy in children with cerebral palsy compared to the general population of Quebec, to compare the healthcare utilization trends in children with both CP and epilepsy to children with a single diagnosis of CP or epilepsy alone and the general population, and then to compare the clinical characteristics of children with CP and epilepsy to those with CP alone. We use the Quebec Provincial Administrative Health Database, the RAMQ, and the Quebec Cerebral Palsy Registry to establish 3 cohorts of children with and without cerebral palsy. A cohort of children with CP was identified from the provincial database using validated administrative codes for cerebral palsy. And then a second cohort of children with CP was also selected from the registry and were matched by age, sex, and administrative region to create a third cohort of controls from the provincial database who did not have cerebral palsy. Within each of the 3 cohorts, we determined the prevalence of epilepsy using 2 different validated administrative health algorithms. We determined the patterns of healthcare utilization using ICD-9 and ICD-10 codes for emergency department visits and hospitalizations. And finally, we drew specific variables from the CP registry to compare the characteristics of those children with CP and epilepsy to children with CP alone. Using the most sensitive definition of epilepsy, the prevalence was approximately 42% in the CP registry, 43% in the CP administrative data, and then 1.39% in controls. These numbers were slightly lower while using the more specific definition of epilepsy. The prevalence of epilepsy also rose with increasing gross motor function classification system level. After comparing healthcare utilization trends between study groups, we found that children with CP and epilepsy had the highest hospital admissions per child per year, emergency department visits per child per year, and longest length of admissions compared to children with CP or epilepsy alone and controls. Using the registry data to compare the characteristics of children with CP and epilepsy to those with CP alone, we found that higher proportions of children with epilepsy had triplegic or quadriplegic CP subtype, while lower proportions had diplegic CP subtype. As well, a higher proportion of children with epilepsy were classified as functioning at gross motor function classification system levels 4 and 5, were born at term, had a diagnosis of hypoxic ischemic encephalopathy, and had cognitive impairment compared to children without epilepsy. Our findings suggest that children with CP have increased risk of epilepsy compared to their peers, and that children with CP who have coexisting epilepsy represent a unique subset of the population of children with CP who have complex developmental disability and increased healthcare service utilization. Our study highlights important areas of focus for coordinated healthcare models to improve care and prevent unnecessary hospital presentations in 2 distinct populations of children with CP with and without epilepsy who have very different healthcare needs. Thank you so much for listening.